All right, good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for Wednesday, September 11th, 2024. My name is Julia Gruss, and I am a research project coordinator at KU's Center for Public Partnerships and Research, and I will be your webinar facilitator for today. I am also joined by my colleagues Brianna Houston and Sarah Gardner. Brianna will be putting relevant links in the chat, so anything that you see on your screen that is a link, she will make sure that that is dropped into the chat during that time. And Sarah will be our presenter for today, but just wanted to get everybody welcomed and reoriented to our webinar. So as always, our webinars are held on the second Wednesday of the month. Sign up for our All In for Kansas Kids e-newsletter that goes out every Monday. You can do so by visiting the Children's Cabinet website at kschildrenscabinet.org. Our presentation today from Sarah is going to be on the 2024 All In for Kansas Kids strategic plan. And then following her presentation, we will have some early childhood systems updates for you. So many of you might remember, but back in March at our webinar, Erica Figueroa presented some of the key components of this 2024 All In for Kansas Kids strategic plan to elicit feedback from Kansans across the state. And now we have Sarah here with us today, who is going to present that final plan. So Sarah, without further ado, you can get started.
Thanks, Julia. Appreciate the opportunity to come and share a little bit about what is really hopefully a dynamic and working plan that all of you who are champions for early childhood here in Kansas see themselves in and can hold as a place to work from and a place to align to. So we're really glad to be able to be here to share this and would encourage you before we even get started to I think Bree can put the link in the chat, but the plan is available online. So you can follow along if you'd like. I'm going to give a brief overview of some of the highlights of the plan. And then I'm actually going to share my screen about where you find it and a couple things that I think are really interesting about the plan that could just serve you well in a sort of day-to-day, week-to-week basis. Even if you're more adjacent or tangential to the plan. Next slide. So what is this All In for Kansas Kids strategic plan? It is dated 2024, but plans like this are big and cannot be hoped to be accomplished in 1 year. So like other strategic plans, this one has a multi-year time horizon. We give this 5 years. Kind of seems like the nice round number for ways to make change and transformation within our system. It is a document that is directly responsive to a system-wide needs assessment that was done over the past 2 years, really. Both of these documents were funded by the Preschool Development Planning Grant. You'll often see PDG as an acronym we use a lot in Kansas. It is a federal funding source. It stands for Preschool Development Grant, but the name is just the title the feds have given it. It is not just about preschool, it is about early childhood, broadly speaking. Kansas has been fortunate to be on the receiving end of 3 of these grants, and that has produced a lot of our system documentation. It's the reason we have these monthly webinars. It's the reason we have this All In for Kansas Kids brand to help us all, despite doing different pieces of the work, be a part of one big system. So that needs assessment was a document that is quite lengthy and is on the Kansas Children's Cabinet website. You can find that under the resources tab. But that document outlined all kinds of needs for our system, both of our system proper, so the programs and services, the needs of our workforce, and the needs of our children and families. And you'll actually see that same structure mimicked in the strategic plan as well. So I would highly encourage folks to check out that needs assessment. We also spent 3 or 4 months getting feedback and input from those of you in the field. So we did, as Julia mentioned, Erica came and shared a little bit on this webinar. We also took the rough sketch of the plan and different goals and objectives to different governance groups, the recommendations panel, the Stay Home Visiting Leadership Team, our Workforce Development Advisory Group. We also took it directly to different providers in the field, home visitors, childcare providers, and professionals. And we had 2 open sessions that families could attend as well. So all of these were virtual. We tried to really elicit as much feedback while also recognizing that you guys have told us what you need over the last 4 or 5 years because of these ongoing communication channels. So it's responsive to those channels as well as those different feedback opportunities. And as I noted, it's a deliverable for our PDG grant. That's just nuts and bolts. You don't have to worry about that necessarily. And then noting where it is available. It's in 2 places. I'm going to show you exactly how to get there on the All In for Kansas Kids website, which is allinforkansaskids, all spelled out, .org, as well as the Children's Cabinet website, which Julia referenced earlier. And there's a resources tab at the top of that website. And you'll find every document created by the system in that resources tab. So if you're looking for a former needs assessment, if you're looking for the former strategic plan, all of that is there on that slide or that site. Next slide, please. So I wanted to just orient a little bit to the purpose of the strategic plan. Like a lot of plans, it can seem like something that that sits on a shelf. I'm looking at Amanda Peterson on screen, and something that her words stuck with me back in 2019. We don't want this to be a plan on the shelf. We don't want this to be something that sits there and collects dust. But we want to be really transparent and honest about what it is and what it isn't. So the plan doesn't come with dedicated funding, right? So if you can think about the plan is really about a North Star and providing that unified vision for how everybody who is doing work in the early childhood ecosystem in Kansas can think about aligning their decision making, aligning their investments, aligning their own plans. Many of you work in organizations with existing strategic plans, perhaps. How can you align your work to the broader system? You can look at your plan compared to this and see where you can plug in work. So I just want to be really clear about that. But it's important to have a document like this so that everybody can see themselves all rowing in the same direction, all driving in the same bus, going in the same direction, insert whatever transportation metaphor you use. But it really is about that North Star and that putting our feet on the ground and saying, this is where we want to go. This is as a system where we want to get to. The document itself, we intended to be very readable as much as possible. And so we organized it into those 3 pillars that I referenced in the needs assessment. We have the ecosystem, we have the workforce, which we define quite broadly in Kansas. And we have some information in the plan about who is in the workforce. And then we have a pillar devoted to meeting the needs of children and families. Just structurally, how you'll see the plan components laid out. We have goals, which are literally full sentence objectives. You can pluck those in and out and use them as they help you. There are detailed actions behind the goals that say how we are going to, the things we are going to do to meet those goals. And then no good plan exists without accountability. And so we have some measures of success inside the document as well to help understand, okay, if we were to achieve this goal, what would that actually look like? What do we think we would need to see move to feel good about meeting that particular goal? Next slide. So that's the overall structure of the document in terms of the goals. There is a bit in the beginning of the document that I think is really can be very helpful for you all, particularly if you're in a position to talk to others about the early childhood system and why it matters. One is a vision that every child thrives. That's what we want to see here in Kansas. It's been our vision for several years now. There's a commitment statement. Kansas early childhood programs and services at the state level typically flow through 4 state agencies, the Kansas Department of Education, Kansas State Department of Education, the Department for Children and Families, Department for Health and Environment, and the Kansas Children's Cabinet. Each of them play a role in helping federal funding flow down, state funding flow across into communities to help early childhood. So it's important that these state leaders, that you know that these state leaders are behind this plan and supporting this plan and working to align their programs and services to do that. There's some really great language and data points in the background section of the plan that you can use as you're talking to champions in your community. A lot of people say, why early childhood? The research is long and lengthy and very clear and very strong about what investing in early childhood does, not just for a child age B to 5, but also when they are in high school, when they are looking to achieve some third grade reading levels, when they are looking to have success as an adult and as an employee working in our state. We also talk about, what do our youngest Kansans actually need? What do our families who have young Kansans actually need? So we feature some of the needs assessment findings. I mentioned the needs assessment as an anchoring document. It's very long. So you can just go to the strategic plan, and we've kind of pulled out some of the highlights for you to be able to see, all right, tell me in 5 bullet points what our youngest Kansans need. That information is in the strategic plan for you in that background section. And then we also talk about, it's not just what we need today, but where are we going? What do we want for our children in this state? And what do we want that future to look like for them? It's important to have that in mind, even if it's a future that some of us on the call may not ever see. It's important to have that point that we can all be working towards and striving towards and feel unified and aligned on that future. And then I already kind of went over the framework, but don't be alarmed by the numbers you see here. 111 actions feels like a lot. Our system is big, and we have a lot of champions and a lot of programs and workers in our system. And so it's a shared work, and it will take time. This kind of stuff takes time to make change, but we want to be clear and declarative about what the changes we want to see. Next slide. The next part of the plan, this is a little bit something we hadn't done in the past quite so clearly, which is define our ecosystem. It's a big word, means lots of things to different people. And so we wanted to be very clear about who was in the Kansas early childhood ecosystem and what actually is it. We referenced the Blueprint for Early Childhood many, many years ago. The state, led by the Kansas Children's Cabinet, declared our Blueprint for Early Childhood means we want healthy development, we want strong families, and we want early learning environments. So you'll see a little bit about that blueprint that helps guide our work. We talk about the 4 state agencies. I referenced them just a bit ago that provide funding. They administer and manage programs. A lot of you working in the community are getting flow through dollars or resources from these programs. It also includes a range of positions and services and resources. So one of the things we heard loud and clear, particularly coming out of the pandemic, is childcare, early childhood equals childcare. And we wanted to note that childcare plays a significant role in our early childhood system. There's no question about that. But so do our trainers, so do our early intervention staff, so do our home visitors, so do our preschool administrators, so do the folks who administer crisis services to families who have little kids. These are all core parts of our early childhood system. I wanted to take the time in this document to really highlight that. So if you go to the next slide, you're not gonna be able to read it terribly detailed here, but these are they're actual screenshots I pulled out of the document, and I'll show you where this is in the document when we get to that point. If you're following along, I believe it is on page 15 in the document, if you actually have it up on your screen. And what we did here is we tried to represent, it's not exhaustive, it's not comprehensive, it's not meant to list everybody, but it's meant to just showcase the variety of professionals, the variety of funding sources that come together to actually support early childhood. And what I would note here is there's a lot of levers for change. Each of these bullet points represents a change point in our system. Somebody who is supporting a family with a young kiddo, somebody who is administering funding or administering programming or providing community level services. All of these bullet points represent points of change and folks with real agency to make change for our system. And so we just wanted to call this out as something that makes Kansas unique, to be frank. A lot of our states that are also preschool development grant states limit their child care system to most of that sort of childcare and home visiting. And we really want to acknowledge that it takes everybody working together. Really want to call out the maternal child health components that healthy mom, healthy woman thinking about having a kid, uh, those are very important services that's really critical to helping make sure that when that child is born, that they are set off to have the best possible start. So really critical. And also the mental behavioral health. We know the data is strong around coming out of the pandemic and the extra burdens, particularly that parents have had to face during the pandemic. And we want to acknowledge the stress that takes and those who are providing mental and behavioral health supports to kiddos, whether you're doing it because it's your job or you're doing it because you see the need in your childcare facility or in your network. It's really critical that we acknowledge the great work you're doing and that you're a key part of our ecosystem. Go to the next slide. Okay, so I'm going to give 3 slides here that do not do justice to the goals and objectives because it's words on a screen, and I want to just give you an overview and inspire you a little bit to go into the document and look and read for yourself and see where you can see your work and your organization. But the first pillar is ecosystem. So there are 6 goals. They are screenshotted here. Can't imagine you're going to spend a lot of time reading them. So at a high level, what the ecosystem pillar and the goals in this pillar are about are four key things. State-local collaboration to meet child and family needs. What we have learned is that locals know best. Your community often knows best what it is that the families and children in that community need. And we need collaboration between those local leaders, those local organizations, and state level programming administrators and funding to support locals in meeting those needs. It really requires collaboration both directions. And what does that look like? And what do we need to improve to make that happen? The second point here is that communities are equipped or should be equipped to connect families to the right resources at the right time. No child comes with a manual that says you do this and this and this and this. And so families stumble into having needs and they need to be able to get those needs met when it happens. It's very difficult to anticipate exactly what you will need. And so having a series of resources at the community that can help point families to where they need to go is really, really critical. We often call these referral services, resource and referral services. There's a couple different names for them, and it looks differently in every community. We have 211s in some community. We have 1-800-CHILDREN. We have our IRIS networks. We have folks who just have been in the field long enough and they pull out their Rolodex and say, yep, I can connect you to that service. All of those are valid solutions. And we need to make sure we're investing in them and providing that available for all families. The next point on here is really using data to measure impact and improve programs. We know it when we see it is a really good strategy, but it's hard to scale that strategy. And so we want to make sure that we can track what is working really well and how do we do more of that? How do we know why that worked and how can we scale that? So data is not just numbers and integers. Data is people's stories and people's experiences. Really, data is all around us, and we want to make sure that folks who are doing really good work, that they can share the how and why of that really good work so that others can learn from it. So it's really critical that we have data and the ability to measure and share data across our system to improve impact. And then we want to expand our resources to increase capacity, particularly including public-private partnerships. There is a podcast out there called No One Is Coming to Save Us, and it's devoted to early childhood. And it's this notion that there isn't a bigger check necessarily lingering on the horizon. And so, how do we use the resources that we have? How do we use the champions that exist in our communities and in our state to bring additional resources to bear so we can increase capacity? And public-private partnerships are a really critical way for this to happen, to really acknowledge that it's in everyone's best interest that we help children, young children and their families thrive. And so how do we bring non-traditional partners like private entities to the table to help leverage their resources and their support? Go to the next slide. Our ecosystem is nothing without our workforce, and the backs and the shoulders that you all have are carrying a big load. And how can we support you all in doing your work better in terms of the system supports? So pretty simple here, not easy for sure, but simple in the sense that compensation and financial sustainability, we're not just talking about childcare workers here. We're talking about rural areas where there are no pediatricians. We're talking about communities that don't have access to early intervention services and support. So compensation and the ability to recruit folks into the field so that they can make a living wage and make a decent wage and provide sustainability for their own families is really, really critical across all professions in early childhood. In addition, we want to prioritize what early childhood workers want to do with their career. How do they want to grow? What do they need to grow? How can they advance in their field? What are the options for them to grow and continue providing the services that they want to provide? One concrete example here is we heard a lot from the field that folks who have been in the field for 15, 20 years, they need higher level challenging in terms of the courses that they're taking and the professional opportunities that they have. And how can opportunities be seen not as moves up, but just deeper growth within a person's field, and that sort of fulfillment that they have, that they know what they need to know to best serve the children and families in their care. Grow the overall EC workforce capacity. I mentioned a couple of examples, but we have a lot of communities without services. Families are driving 2 and 3 hours. You all know this because you all are in those communities and making those referrals and supporting families, but we've got to be able to have more folks providing this service. We have a lot of folks who've been doing the hard work and are inching closer to retirement or feeling like a different field is better for them. And so it's not just recruiting new people into the field, but it's what can we do to retain the workforce that we have, recognizing the challenging environments that they are working in. How can we make that easier, and how can we keep them and their expertise in the field? That institutional knowledge is so critical for families. And then we want to make sure that we're equipping the workforce to produce those high quality environments and services. We know that high quality environments in early childhood, that research part that I mentioned at the beginning, it's so strong. Those quality environments matter. They matter a lot. There's a lot of data behind that. And so what is it that you as the workforce need to ensure that you can provide that high quality environment? Is it new trainings? Is it new resources? Is it different technology? What can we do to support those quality environments? Is it place-based improvements? You know, we had some different grants that came out over the last couple of years that a lot of organizations use to just upgrade materials, and those are things that matter. So we want to do more of that. And you can go to the final pillar section, the next slide. And then the final pillar here is about children and families. And I want to call out a couple of things on this particular pillar. There's the obvious stuff that I've kind of already hit on, the need for high quality environments, the need to support all children ages birth through 5. But there are a couple pieces here that I want to highlight. One being the well-being and mental health of children and their families. I mentioned the maternal health component. It's really critical that children have their basic needs met, that families have their basic needs met. Because if we don't have those basic needs met, we've heard from a lot of families, I can't even engage with the early childhood system. I can't even think about that. when I'm struggling to make ends meet, or I don't have consistent transportation or housing. And so there are some and things here around meeting the basic needs of families with young children and recognizing the challenging period of life that comes with early childhood for families, and how can we prioritize that well-being. We also want to engage families in meaningful ways to improve programs. Family engagement is a phrase that is used a lot and means different things to different people. And I would say for this plan, there's two things to think about. One is meaningful engagement for families. It may not be that they come to a meeting, that you have parents at the table, because parents are busy, very, very busy, but their perspectives and their voices should be front and center in those conversations, even if they physically are not able to be there. And so how can you bring those perspectives and those voices into the room when you're making organizational level or investment level decisions, or even programmatic decisions? I know it's challenging, but I think it's really critical that we prioritize that. And Kansas does a good job in this. Lots of different family engagement efforts across the state, and it's just something to continue prioritizing. The second part about family engagement is making sure that they are informed and that they know what their options are. And recognizing, particularly for families who have children with special health care needs, um, that system it can be challenging to navigate. So you want to make sure that families know what to expect. They know what the landscape is around them, and how can you help inform them so that they can then make the best decision for them and for their child. So really helping families make informed decisions. That might mean that they're not looking for your service, but your job in the system is to make sure that no matter what door a family walks into, that they leave more informed and more connected than they did before they arrived. Okay, you can go to the next slide. So those are the three pillars. The next couple slides here just kind of walk through the end of the document. So this is what I call that's the now what. Here's the so what. So what? We know all these things. None of this is rocket science, Sarah. I've been saying this for years. Glad someone finally listened to me and put it down on paper. Now what do I do? So we tried to be a little bit specific where we could around pathways to action. So you're already doing great work. We don't want that to change and to shift. But where are there pathways? I think of it as a rushing river, or maybe double Dutch if you played that in jump rope. Like, how do you figure out where do you jump in? Where does your organization kind of get into the flow of the work? So I call those pathways to action. There's a couple different opportunities at the state level. I highlighted a few here. These are different governance groups that are meeting regularly, and they are looking for voices. They are looking to make impact on the system, on the programs that are part of these different groups. I have more about those groups in the plan itself, but at a local level, we hear about change happening at the local level all the time. And of course, the champions look different, but you've got, thanks to Child Care Aware Kansas and all of their efforts, a lot of child care coalitions that have very different champions. Some are led by businesses, some are led by economic development, some are led by child care providers themselves wearing their 17 hats. But there's all kinds of what's happening in your community and how can you get involved, or how can you have others get involved in that. We have local interagency coordinating councils, or LICCs. You often hear that referred to. These are groups who are really addressing the holistic needs of young children and their families, particularly around special healthcare needs, and making sure that the variety of needs that are there for children and families in a community are getting met by the different resources and programs and services that need to be there to help that support that family. We have family resource centers. You can think of that as lowercase FRC. You can think of that as uppercase FRC, because we have several folks, several organizations who are doing, hey, what do you need as a family? How can I connect you to services? And then we have some who are actually funded to be family resource centers, but they're all across our state. Parent engagement groups, KCSL is really great at this. Head Start Association is also really great at this. I'm sure many of you are connected to different parent engagement groups. Think about your PTOs, your PTAs, things like that. We also have different local live well or healthy community groups, folks who are standing up initiatives that may not have anything directly to do with early childhood. Maybe it's about healthy nutrition, maybe it's about a healthcare initiative. Go to those, plug in early childhood into those conversations, bring more champions to the table. And then I've also kind of made a reference to our chambers and our economic development groups. Next slide. These are just words here that I've kind of already said around how do we maximize the investments we already have in early childhood while we attempt to solicit new funding into our system. How can we strengthen our private sector partnerships? How can we rethink or ask for flexibility, perhaps with federal funding to optimize our impact? And then how can we make investments that open up funding at the local level? We've been trying to really explore this and find out what private resources might need to open up their resources to help support early childhood. And you can go to the last slide. All in for Kansas Kids, it does mean something. It means all of us in the ecosystem. And I've just kind of listed a few of the ways that different folks or the types of folks who are in our ecosystem and who it's going to take to make change. So families and caregivers play a role, policymakers play a role, business and community leaders, service organizations, all of the professionals caring for our children. So a couple things you can do immediately before I kind of walk you to the site is if you want a hard copy of the plan, it is yours. Just reach out. You can actually reach out to Julia, or you can put something into the contact us form on the All In site. We're happy to get you a hard copy so you can have the document available. We want to know your thoughts and ideas. So there is on the strategic plan page, there'll be a place to respond. And we want to be able to share back progress updates and not just like from the system perspective, but what's happening at the local level that we can share. What we know is that bright spots are great. Bright spots with a lesson learned and things to do or not do is even better. So how can we take the good work you're doing at the local level and help share that for someone else to learn? Or how can we help connect you to build partnerships across the state? So that is my deck. Julia, do you mind if I go ahead and share my screen?
Right ahead.
Okay. All right. And I recognize it's not going to be terribly large and legible, but I just want to orient you to where you can find the plan. And then I want to highlight a couple places that I think you can use today or tomorrow, particularly as you're talking to folks about early childhood. So the first is navigate to allinforkansaskids.org. You're going to go hover over to the About page and drop down, and you'll see Strategic Plan. That will take you to this page here. There's two key resources on this page. One is the full strategic plan. So you can click on this button and you'll get the full plan to pop up for you. The other is a summary. And so the summary document is just the pillars and the goals underneath. So if you want the strategic plan in one page, that summary is for you and can be very helpful if you're just looking for alignment materials, orientation materials, perhaps you're onboarding some new civic leaders in your community. What a great document to potentially take with you if you're sharing a little bit about what early childhood means in Kansas. So I'm going to go to the strategic plan itself, which is a PDF. And there's the plan. Great photos here in the plan. I want to call out the commitment statement. I mentioned this is the commitment statement from our 4 state agency leads. Okay, so things I want to show you here are these key data points. There are snippets of data points throughout this document that can become talking points for you, that can become North Stars for you. So here's the first one. 1 million new neural connections happen every second during the first few years of life. What a powerful data point. Someone's like, why early childhood? more than 90% of a child's brain architecture is developed by age 5. So as I mentioned, there's a lot of research. This is just a little snippet of that research. So here's something you can pull from. The next one is here. These are a couple key data points. When we invest in our youngest children, they are 20% more likely to be well prepared for kindergarten, 20% more likely to graduate from high school, 70% less likely to be arrested for a violent crime. So again, these are just like, why early childhood? Why should I invest in early childhood? All of these have citations next to them, so you can actually go to the end of the document and see where that data point came from. If you get any pushback or you have an I wonder about that data point, you obviously have your own, I'm sure, but these are just some data points you can pull from. I will go to this. I mentioned the key findings from the needs assessment are pulled out and put into this document. So you've got a couple of these key findings from the larger needs assessment available to you. And then let's go to the first ecosystem section. At the beginning of every, sorry to make you seasick with watching me scroll here, but at the beginning of every pillar, it's 2 pages. The left side gives you a summary of what the ecosystem is. The right section gives you the goals, and again, some of those snippets, some of those data points that can help you drive home the point you're trying to make about why investing in early childhood is so important. If this can become common shared language that everybody in our state can espouse, then we're halfway there, right? We're getting people to really say the same thing about why early childhood is so important. So there are these data points in each of those pillars, and they relate to those particular pillars. So please use those as they work for you. And then the last thing I want to show you is throughout the document, and I'm going to use this one here as an example. You will see some of the words inside the actions actually highlighted. So for example, on this one, community-based referral networks is highlighted. We picked a couple of these that we thought were really important to elaborate, either because it was a word that was confusing or it was a phrase that was really important that we backed up with data. And so you'll see a couple of these called out, and then there's a larger blue box here where we actually say, okay, this action is increase the number of community-based referral networks. What are you talking about here? Oh, here's what we're talking about. This is what we mean by community-based referral networks. So if you're just scanning the document and looking for some of those highlights, I'd encourage you to look for some of those boxes. They're not on every single goal, but there's several of them throughout the document that help convey what we're trying to do here. So those are some of the highlights I wanted to show you in the plan. If you're pulling it up and you're trying to think, I don't have time to read a 50 some odd page document. Here are some highlights and things that you can, maybe even use and fold into your work this week. So with that, I will stop sharing, Julia, and I'm happy to take any questions that folks have or any comments that folks have. But that's what I wanted to share.
Yeah, if there are any questions or comments, you can write it in the chat or go ahead and come off mute and just ask them directly. We'll give you a couple seconds to do that. Just some thank yous coming through in the chat. Great information. Alrighty, well then with that, we will move forward into our early childhood systems updates and then send you on your way this Wednesday afternoon. So starting off, help shape the future of NAEYC's accreditation process. NAEYC, of course, is the National Association for the Education of Young Children. You have the opportunity to participate in a pilot study of NAEYC's new tiered program quality assessment system. They've announced plans for their newly revised quality assessment and accreditation system with tiered levels of quality assessment. The process will be simpler, and tiers will allow programs to progress at their own pace. Before this new system launches in March of 2025, NACCE is looking for a diverse group of programs to participate in a pilot study of the new system. The pilot study will evaluate the reliability and validity of the tiered assessment system across diverse communities and program types. So you can learn more by going to the link that Bree will place into the chat about the plans for the new system. And you can also submit an interest survey to be considered for the pilot study. That link will also be placed in the chat for you. Childcare Community Partnership grants being offered by Childcare Aware of Kansas. They are announcing that they are offering these Childcare Community Partnership grants for the 2024-2025 fiscal year, awarding 15 community-led coalitions with $30,000. Last time we mentioned this at a webinar, we did not have the dates for the application period, but those have been posted. So that was opened on September 3rd, and those applications will close on October 31st. They're offering grants to support community-led coalitions with a focus on advancing childcare capacity in your community. All interested coalitions must contact their community outreach and engagement coordinator to obtain grant login information and application details. You can find more grant information on Childcare Aware's website. Next, we have another funding opportunity through KDHE, the Child Care Health and Safety Grants. Child Care Matters and the Kansas Department of Health and Environment are assisting facilities in achieving licensing compliance. So starting this month, KDHE is providing grants for licensed facilities with regulatory or statutory violations to assist in correcting these violations with minor renovations, repairs, or other safety-related expenses. These grants play a pivotal role in ensuring childcare facilities remain operational and children in care have healthy, safe environments to thrive. These applications are going to be open through June 30th, 2025. You can check your eligibility and apply for funding on KDHE's website. Next, we have some early childhood resources and professional development through Greenbush and Kansas Children's Service League. Greenbush, their free resource for families and professionals, their Family Connect modules. They currently have a series of 8 one-hour interactive modules connecting families to resources and services to promote the healthy development of children ages 0 to 5. The available Greenbush modules are Families as Foundation, Families as Communicators, Families as Advocates, Families as Partners, Families as Community Members, Choosing Quality Childcare, Understanding Child Development, and Health and Education Partnerships. So that link in the chat will take you to their website where you can find these modules if you are interested. And then KCSL offers several trainings for child abuse prevention, trauma-informed care, and more, which also qualify for childcare licensing hours. So to learn more and to register for any of KCSL's sessions, you can go to their website. Reminders and next steps for some of our upcoming meetings. Our next 2024 Early Childhood Recommendations panel will be held on September 20th from 9 to 11:30 a.m. This meeting is live streamed on the Children's Cabinet YouTube channel. The next Children's Cabinet meeting will be held on Friday, October 4th from 9 to noon. And our next Early Childhood Systems Building webinar is going to be held held on Wednesday, October 9th. This webinar, we are actually going to have several of our innovation communities grantees that are grantees through the Child Care Capacity Accelerator. They're going to come and talk about the innovations being made in their communities and how you might be able to adopt their practices into your childcare setting. So that should be a very interesting webinar to attend on October 9th. And as always, you can find all of these meetings and more on the Children's Cabinet YouTube channel. Stay up to date by signing up for that All In for Kansas Kids e-newsletter, following us on X, formerly known as Twitter, and also subscribing to the Kansas Children's YouTube channel. Thank you so much for your time today. Thank you again to Sarah for that presentation on our 2024 All In for Kansas Kids strategic plan. If anybody would like a hard copy, you can send me an email at jgruss@ku.edu. And my spelling of my name should be right next to my face on your screen. But that's jgruss@ku.edu. So thank you everyone again and have a wonderful Wednesday.